Hi, I'm Dr. Brianne Kelly with the Rosti Rehab Centers, and today we're going to learn about Achilles tendonitis. First, we're going to talk about the causes of this condition. Then we're going to talk about the signs and symptoms that might indicate that you have Achilles tendonitis. Additionally, we're going to talk about how traditional healthcare typically approaches these injuries and how a Rosti is a little bit different. Let's get started. So Achilles tendonitis is an overuse injury of the tendon at the back of the heel that's combined with an abnormal healing response from the body because it can't handle the amount of stress being put on that area. Now, this condition is divided into two categories, the first being insertional and the second being non-insertional. So what does this mean? Insertional means that the pain is at the insertion point of the tendon where it attaches to the calcaneus or the heel bone, and non-insertional means pain is in the middle of the tendon. Now let's go over some of the causes. Typically, this condition is more frequent with increased age and obesity. However, it can be common with a sudden increase in activity that you're not used to, or repetitive strain from improper joint movement of the foot or ankle. Now let's discuss some of the signs and symptoms that might indicate that you have Achilles tendonitis. With insertional tendonitis, pain is worse first thing in the morning or the day after activity. Sometimes there can be occasional swelling or stiffness. With non-insertional tendonitis, pain is worse at the beginning of or shortly after activity, and again, there can be some swelling. So how does traditional healthcare usually handle Achilles tendonitis? Typically, this condition is managed conservatively with ice, non-steroidal anti-inflammatory drugs, restroom activity, light stretching or massage, and sometimes a brace or a walking boot. On average, expected recovery time with traditional care is 3 to 6 months for insertional tendonitis and 4 months for non-insertional. Now let's talk about how a Rosti is a little bit different. Our average number of visits for complete injury resolution is between 3 and 4 visits. We spend a full hour with patients and perform a thorough evaluation so that we can get an accurate diagnosis and get to the root cause of your pain. We perform specific hands-on manual therapy followed by active care with specialized exercises and stretches that you can perform at home to help maintain the progress made during treatment. Thanks for watching. We hope that this information was helpful to you, and if you or a loved one is experiencing Achilles tendonitis or any other pain or injury, click right here to learn more. If you'd like to check out some of our other videos, click up here, and don't forget to subscribe to our YouTube channel. Have a nice day, and we'll see you in the next video.